Have you ever wondered about the invisible threats lurking in your pet's environment, especially for the young or small ones? Today we turn our attention to Coccidia, a microscopic parasite that can wreak havoc in our pet's intestines. Coccidia are tiny parasites, often confused with worms due to their similar detection methods, routine fecal tests. But make no mistake, Coccidia are not worms and they are not visible to the naked eye. Unlike worms, they're immune to typical deworming medications. Their preferred host? The intestines of our beloved pets, where they can cause watery and sometimes bloody diarrhea. The story of Coccidia begins with oocysts, which are passed in the stool and mature in the environment, becoming infectious within a span of 12 to 36 hours. If these oocysts are inadvertently consumed, the host is likely to become infected. This is why it's so crucial to remove feces swiftly, to prevent the environment from becoming a breeding ground for these infective oocysts. Once inside the host, the oocyst releases 8 sporozoites that infiltrate the intestinal cells. Here they divide rapidly, forming merozoites. As these merozoites reproduce, they cause the intestinal cell to burst, releasing more merozoites that infect other cells. This destructive cycle results in bloody, watery diarrhea within 3 to 11 days. Uncovering a Coccidia infection requires routine fecal tests, particularly in young animals or those with persistent diarrhea. Small numbers of Coccidia can be challenging to spot, so in cases of stubborn diarrhea, you might need multiple tests to diagnose it accurately. Now onto the good news, treatment options. 2 effective treatments for cystoisospora infections are sulfa and coccidiocidal medications. Coccidiostats, the most commonly used medicines, inhibit coccidial reproduction, giving the immune system a chance to eliminate the infection. The treatment duration can range from 1 to 2 weeks, depending on the initial Coccidia count and the strength of the patient's immune system. While sulfa-based antibiotics are frequently used in dogs and cats, newer medications such as ponazuril and toltrazuril directly eliminate Coccidia and require only a few doses to work. In summary, Coccidia are microscopic parasites that can cause significant health problems in pets, especially the young or small. They originate from oocysts that mature in the environment and become infectious. Ingestion of these oocysts leads to an infection that can cause bloody, watery diarrhea. Detection requires routine fecal tests, and treatment involves sulfa drugs or coccidiocidal medications. Remember, prevention is the best cure. Regular cleaning and swift removal of feces can significantly reduce the risk of Coccidia. So, stay vigilant and keep your pets healthy.